to the Educated Podcast, the show that unlocks the real stories and innovations behind the Doctor of Education experience so you can become addicted to what's possible with a Doctor of Education degree. Each episode welcomes trailblazing educators, industry innovators, and visionary policy leaders who share how their doctorates transformed their lives and their careers. I'm your host, Dr. Minerva. Today, I am thrilled with a capital T, all caps, to welcome someone whose work sits right at the intersection of education, public health, and prevention of firearm-related harms. Dr. Sonali Rajan is a tenured professor of health promotion and education at Teachers College, Columbia University, a national expert on school violence prevention, a partner, a mother, a runner, and right now, she's on sabbatical. Serving as a senior director of research at Everytown Research and Policy. Sonali, welcome to the show. I am so glad you're here to speak with us about your EDD journey.
Thank you so much, Dr. Minerva. I'm so happy to be here and also just to have a chance to see you and get a chance to catch up together. This is going to be great.
I agree. It's great to see you as well. I want to start with you as a person. Before we get into the titles, the accolades, and the institutions, when you think about who you are in this season of life, how do you introduce yourself? Who is Sonali Rajan in this season of work and life?
Oh, that's such a good question. Really and truthfully, when someone wants to know who I am in any way, my first response is always, I'm Nikki's mom. And so I have a fifth grader who anyone who spent about 5 seconds with me knows that I am just crazy about and is the love and light of my life. And so I would say mom first. Mom, that is a really important hat that I'm wearing these days. And always, of course, as a partner and wife to my husband, Andy, of many, many years. And so I think family right now is really an important, it's always important, but right now really feels very just core to my day to day. And then professionally, if someone says, who are you or what is the work you do, I really very strongly am and identify as a gun violence prevention researcher. And I don't think I would have always said that. Obviously, Minerva, parts of my life and career have been dedicated to lots of other aspects of child health and safety. But I feel very passionate about the research that I'm very privileged to do and to the field of gun violence prevention. So those are the two answers I would have to that question.
Okay. Well, it's a pleasure to hear how you would introduce yourself at a dinner party. I love starting there because it reminds us that behind every EDD is an actual person with a very full schedule. Let's rewind a bit and talk about how all of this began. Take us back to the beginning of your doctoral journey. You went to Teachers College with a Cornell University engineering degree.
Yep.
That's not typical for health education.
No.
What were you searching for that an engineering degree couldn't give you?
That's such a good question. So for our listeners, my bachelor's degree is in biomedical engineering from Cornell. There were lots of aspects of that work I really loved. I spent most of my undergraduate years obviously studying, but also working in a lot of different labs. So I did a lot of biomaterials work, and one of the very first publication I ever was a part of is on bone bioreactors. So a totally different thing. Honestly, I also as an undergrad was pre-med. So I always had some interest in pursuing a career that involved working with others and supporting others. I always imagined it to be more in the healthcare side of things. And I liked doing research. I enjoyed that part of it, but it wasn't really filling my cup. But when you're 18, 19, 20, it's hard to really know what that looks like. And when I was a senior in college, I applied, like many of my friends did, to PhD programs in bioengineering, and I was actually all set to go to Tufts. In fact, that was my plan, is I was going to go to Tufts University in Massachusetts after I graduated, and I was leaning towards pursuing graduate studies there in this field. And I will say, I'll just give this story very briefly, but I think it was really important. My senior year at Cornell, I had to fulfill one last elective requirement. And I honestly picked an education class that happened to fit my schedule. And the class was really cool in the way it was set up, where in the fall semester, we were all in class and learning about pedagogy and Dewey and like luminaries in the field of education and what that means. But in the spring, the professor of that class placed every single student at a local school in and around the Ithaca area. And so the spring of my senior year, I would get up at a very early hour twice a week and I would drive out to a town pretty like about an hour outside of Ithaca proper. And it was an alternative school, an alternative middle school for kids who had lots of different behavioral challenges, who had experienced trauma, like all sorts of things like that. And I literally would go twice a week and just provide classroom support for these really wonderful teachers and these kids, these great kids. And it was just such a formative experience. And I loved it so much, even though I was tired and, all of that. And I just had a little bit of a moment where and I said this probably to my parents and to my sisters, and I had just started actually dating Andy at the time. And I was like, I don't know, maybe I don't want to go to graduate school for bioengineering. Like maybe I want to do something else. And with their encouragement and actually the encouragement of a faculty mentor at Northwestern who I had worked for the summer before, Phil Messersmith, they all encouraged me to explore something else. They were like, maybe you could work for a little while, maybe you can see if there's other graduate programs that could sort of combine what it is you're looking for here. And so I literally, in the era of 2005 Google, I stumbled upon the Department of Health Studies and Applied Educational Psychology at Teachers College. And it was such an interesting mashup of the things that I was interested in, which was kids and their health and but also the school component. And I just thought, oh, how interesting is this to potentially, how interesting would it be to maybe pursue some work here? And so I actually wrote to the department chair at the time and I said, my name is Sonali and I have this bachelor's degree. And what would it take for me to get into your master's program? Or I think I said something like maybe I could work for a couple years and come back and apply. And they were so encouraging. They said, well, why don't you just come do a master's with us, see how you like it, and we'll go from there. And so I moved to New York. I lived in this little apartment in Washington Heights with five other people, and for 1 year, pursued this Master of Arts degree in our department. And I loved it. I just loved everything about it. It was so interesting. It was multidisciplinary. It exposed me to all of this like work and writing and like social science research in a way that I had never really thought about before. And I just loved it so much. I applied for the doctoral program. I decided to stay in and continue that. And then as you know, I do because I am an engineer at heart, and so I do love math and I love statistics. So I also used my graduate time to earn a master's of science degree in applied statistics to complement my research studies, and sort of the rest is history. I also really loved my dissertation. I just everything that whole experience was really, really positive for me. And it just felt right. And again, none of this had anything to do with gun violence per se, but it really just laid the groundwork for me in thinking about what social science research can and should look like. And I just loved that so much. I always just have a lot of gratitude for those few years, which really were so, again, so formative for my development.
Yeah, that brings a smile to my face. I still hear your excitement and the wonderment, right? Wow, that's really incredible to hear. As a doctoral student, what were you most afraid of?
Oh my gosh. I mean, probably failing, right? Like, think, isn't that like the human art? Like, you want to do really well. No one goes to graduate school and wants to flounder. And my dissertation involved a lot of work with Girls on the Run, which I know you and I have talked about before. But that program and organization is an organization and work that's very near and dear to my heart. And I wanted to make sure I was doing right by them and showing up for them and that work. And I think I just really it was a leap of faith, right? To sort of completely change my career, to shift in my mind to go from a much more medical sort of health systems oriented career set of career goals to something that was felt more ambivalent, maybe felt more ambivalent and maybe wasn't as clear. So I think for me, just wanting to make sure that I was, I basically just wanted to work. I basically worked as hard as I possibly could during that time to make sure that I took advantage of that time and also didn't miss out on whatever training I needed to do to show up as a researcher in this space.
Yeah. The part that you said about working as hard as you could, that really like stands out to me, right? Like when wouldn't you work hard?
If I'm being honest, I felt a little bit, I remember this actually very vividly. My first day as a graduate student, and Columbia is like this beautiful campus, and I show up and I felt like such an imposter, really and truly. Like I was like, oh my God, I have no psychology training, no background in the social sciences. I have these other experiences, but nothing here. I remember calling my mom. And she was, of course, so reassuring. But I just remember feeling very out of place initially. Like, oh my gosh, I am not cut out to be here. And I also don't have the appropriate training to do this work. And what I found, and this is, I think the faculty there were very supportive of saying, no, you do. You have these skills and they're very transferable and all of that. But I think I was very, very motivated to kind of prove to myself that I deserve to be there, if that makes sense.
Thank you for sharing that. Not many people would think that someone who has already gone to Cornell, which is another Ivy League school, would have imposter syndrome, right? But you totally scaffolded that and explained why and where that came from. Additionally, nearly every doctoral student has that moment of like, what am I doing here? Did you ever ask yourself that question beyond the initial entry admission?
I think when you're a doctoral student, as you know so well, right, we think we have the coursework itself, and that the coursework is very prescriptive. So it's like, okay, I have to take these courses and meet these requirements. But then there is this entire intense process of coming up with your own dissertation research idea, putting those ideas out there, defending them to your faculty and mentors and committee, and then carrying out this proposed work with integrity. And I think that is really hard and scary to do, but that is so core to launching someone. That's what it takes to be a researcher, right? Is to be able to have those skills and to have the confidence to do that work. I had a lot of ideas about what I wanted to do, but it's nerve-wracking bringing in stakeholders from other organizations, doing primary data collection, hoping that you understood your regression analysis class or linear models class enough to actually do your data analyses on your own, like just and to make sense of what you're finding and then to publish your work. Like these things are all really scary, and to do them more or less for the first time as a doctoral student, I think is somewhat a universally like scary experience. So I think all of it felt scary, but like almost in a good way. I felt pushed to do this work and also like supported in the process of doing it. So
Yeah, that's really what do you call it? Inspiring, right? To hear how you were supported and felt pushed all at the same time, and you still wear a smile on your face. You built
that's just because I'm happy to see you. So there you go.
well, thank you. That's important. You built a research career that rivals anyone with a PhD. When someone implies an EDD is less than a PhD, what do you want them to understand about what this degree actually trains you to do?
That's such a great question. I think about this a lot. I've been a faculty now for 14 years, a long time. So I've had lots of students and colleagues with whom I've worked, and I've thought about this quite a bit. So I first of all feel like it's important for folks to recognize that there are lots of different types of doctorates, right? There's doctors of education, doctors of public health, doctors of science, doctors of social work, like, and quote unquote traditional PhDs. And I have the privilege of supervising our EDD students, but I also supervise PhD students in other departments and programs. And so I will say that at the end of the day, they're all basically teaching you the same skills, right? You're being trained to be a really rigorous, thoughtful researcher. The difference and nuance is that in an EDD, often we talk about and train our students to apply those research skills to different education settings, right? Or if you have a doctor of social work degree, there's an application of the research in clinical settings or so on and so forth. I have seen brilliant folks with doctorates in these other areas who have gone on to do wonderful, amazing work. And I've seen folks with PhDs who have maybe done work that maybe is less impressive. I think that's just how it is. I don't think that the degree itself makes a whole lot of difference. I think there's just nuance in the field. What I actually think matters most importantly is what do you do with your degree? So I always say to our students, are you making the most of your graduate experience? Are you pouring everything you can into this, learning as much as you can, not taking shortcuts, right? Like it's really important to make the most of the training. And then when you're done, what are you doing with that training? Are you working as hard as you possibly can? And I am very much of the mindset that like in academics and in the research fields in general, our goal is to amplify and support each other, right? I try very hard to help, or I try the best I can to navigate folks away from pitting fields or degrees or titles against each other. And I appreciate so much that you are doing that in this space here, because I think it's really important that we elevate the work that each of us are doing, but also to recognize that like the work that EDD trained individuals bring to really complex social problems is so important and very complementary to the skills that folks with other types of doctoral level training bring. And they're all important and needed. And so I've seen that, and I can talk about this more later, but I've seen that quite a bit in the gun violence research world. And I think it's important for most public health and education problems that we're all trying to solve.
I love that. I nicknamed the EDD as enjoying dissertation done. So it was such a relief. So, speaking of which, could you tell us the focus of your initial dissertation?
Yeah. Oh my gosh. I could talk about this all day, but I won't. I'll give you a very brief summary. So, when I was in graduate school, I started coaching as a volunteer coach for the program Girls on the Run, which is an evidence-based life skills program that has a running and movement component, and it's designed for girls. They have an elementary school program designed for girls in third through fifth grade, and then a middle school program designed for girls in sixth through eighth grade. And Girls on the Run is now 30 years in the running. And I think they have at this point served nearly, I want to say it's more than 2.5 million girls across the US. It is a huge, wonderful program. And I could talk about them all day, every day, but they are just some of the most wonderful people and women in particular who have just done so much to lead in this space, but also who have served as mentors and friends to me for like literal decades. So I adore them just so, so much. And I loved coaching. I coached these girls at a school right on the Upper East Side over here. I would show up twice a week, and I'm still actually very good friends with my former coaches. And I just love that the act of coaching was just something. And I coached for years. Like I probably coached for like 15 years, like a really long time. And I just loved that. It was something that brought me so much joy for a very long time. And basically, while I was doing that and I was thinking about, and honestly, Girls on the Run is a really beautiful example of health promotion and health education in schools. And I knew I wanted to, I had really I was very clear I wanted to do work, a dissertation that really focused on the health and well-being of children. Honestly, this was like in 2006, I think. Or 2007, I emailed Molly Barker, who's the founder of Girls on the Run and continues to be one of my just a very good friend and colleague for me. And I literally sent her a cold email. And I was like, Dear Molly, I was like, I'm a doctoral student, I'm a coach, blah, blah, blah. And I just said, like, does Girls on the Run have any like evaluation needs or anything that I could maybe support you in? I don't need to be paid. It's just, I'm really passionate about this. I'm thinking about my dissertation. Molly wrote me back within like 20 minutes. It was amazing. And she said, I'm actually coming to New York City in a couple weeks. And she goes, maybe we can get coffee. So she and I met like in this little coffee shop in Midtown. And we were supposed to meet for like 30 minutes. And I think we ended up talking for like 3 hours. And when you just meet someone and you just are like, oh, this person is going to be a person who shapes like is important to my life. That is Molly. And she basically was like, she said, we have a curriculum for our middle school girls, but it needs to be rewritten and revamped quite extensively. Just things change and we really want to pour some more time and energy into that. And then it will need to be evaluated. And so that's what we did. She and I co-authored the middle school curriculum for Girls on the Run, which at the time was called Girls on Track. And we evaluated this, and this is what my dissertation was. I evaluated the implementation of this program in 21 different schools across the US. And it took a long time. It was a really extensive data collection process, and it involved just so many people contributed to making that evaluation possible. But I loved every minute of it. It was fun. It was interesting. I learned so much. We collected data from the coaches. We collected data from council directors. And then we also collected data directly from the girls. And this was before things were electronic. And my husband and I were living in this, we weren't married yet, but we were living in this really tiny apartment in Brooklyn. And I would mail out these surveys, and then I would have stacks of surveys coded color by color, organized around the apartment, and like just trying to make it was just the whole thing was, in hindsight, was kind of crazy. But this whole process took like a good couple years to do. And then I defended, and I officially graduated in the spring of 2010, and then I started a postdoc. That was my doctoral experience.
Wow. Andy does sound awesome to be cool with you having color-coded surveys all around your apartment.
Andy is a wonderful and very kind and lovely spouse. Yes.
I'm so glad you have each other. So the dissertation process, it has a way of revealing things about ourselves. You talked about the joy and you talked about how formative and exciting it was. What did finishing your dissertation teach you about your own tolerance for ambiguity or even your voice as a scholar?
I think about this a lot, which is that I imagine that like the general public, folks might think that research is I'm sort of maybe sitting somewhere and kind of I think about an idea, I have a problem and I think about a solution and then poof, there's like and then that somehow that solution emerges. But research, as you of course know so well, really is so iterative and it takes it just the reason we do what we call literature reviews and the reason we have to synthesize many, many publications to actually get at an answer is because every study contributes to some insights and knowledge, but also often leads to lots more questions, right? And I think that I think that is uncomfortable, right? For a lot of us. I think we would like to be able to say, this policy leads to this outcome, end of story, or this program does these four things, done. And it's just, we're working with people, human beings are complicated, and it's not ever that neat and tidy. And I think coming from the biomedical engineering world, where I literally was growing cells in petri dishes and doing and controlling environments in the most clinical way, to then studying kids who, as both a mom and a researcher, I can say, is every kid has such unique needs. And so trying to generalize from that, it's really, really hard. So I feel like graduate school for me and the EDD process and all of this really challenged and pushed me to be comfortable with that discomfort. It's still something, though, I think about constantly in my work. These are just like works in progress, right? Like things that we're just constantly having to be okay with. And that's part of doing research. That's part of doing social science research, I think.
Yeah, that's quite a shift from a single meeting that led to a dissertation to 21 schools where you coached Girls on the Run for over a decade to having a public health lens on gun violence. That really sets up the work that you're doing. And so let's dig into how you explain that to people. School violence prevention as public health. How do you explain why treating gun violence like a disease outbreak rather than just a security problem changes our perspective about what we can do about it.
Yeah, so I think about this obviously a lot, and I will say that part of the directions of research I have pursued in the area of gun violence prevention have stemmed in part from just thinking about how we study gun violence versus how we study other problems, right? How we study motor vehicle safety, or how we try to prevent drunk driving, or how do we prevent or address cancer, right? Like thinking about any other, like lots of other, like there's lots of complex, really, really heartbreaking issues that our world is contending with. And in when we think about gun violence, like if you were to ask somebody what prevents gun violence, typically that a person might mention maybe a specific law or policy, or they might mention something related to law enforcement. But that's usually where the conversation ends, and it's usually where the discourse among like pub elected officials and others tends to sit. And to be clear, gun safety policies are incredibly important, and law enforcement also plays and can play an important role in community and public safety. But that captures such a narrow range of possible solutions here. Gun violence, like any other public health issue, benefits enormously when we actually invest in upstream determinants, when we break those cycles of disenfranchisement, when we invest in communities with care and compassion, when we think about schools as sites of belonging as opposed to places where we are constantly punishing students for existing. I think there is a world in which investing in green space in cities and thinking about other place-based interventions, street lighting or public libraries or affordable housing, thinking about like just all the different levers we can possibly pull. When we do that, we're going to address gun safety and firearm access. We're going to address community level investments. We're going to address what's happening in the school environment. And we're going to normalize conversations about secure storage and make sure that kids are living in homes that are safe. Like when we actually do all of those things, not only will we meaningfully reduce gun violence, we will also see all of these other amazing benefits to our communities and schools. We'll see better mental health. We'll see improved social cohesion. We'll see kids eating better and sleeping better. Like everything at the end of the day, I feel so passionately about this, but everything at the end of the day, when people feel fundamentally safe, when kids and teens feel safe and they feel supported and cared for, we see so many other benefits beyond even just addressing gun violence as an issue. And I think what gives me a lot of hope in this field and in this work that I have been doing for a long time is the fact that we have seen pockets of those successes. And we've seen what happens when we do make those investments and when we do think about, again, pulling on all those possible levers.
When I hear you speak, I think about environmental health.
Mm-hmm.
The environment plays such a huge role in our everyday lives. And for most people, when they think about environmental health, they may think about like climate change, but the social environment is so integral to how we interact, to how we work, to how we play. When did you start seeing gun violence as a public health problem that prevention science could address?
The very first paper I wrote in this field was with my best friend, who also studied biomedical engineering at Cornell, actually. She was my college roommate. And she and I published a paper together in 2014. And so that paper actually really lent itself to helping me understand and make sense of the fact that, yeah, there are a lot of teens in this country carrying firearms, and they're not necessarily doing it because they might be struggling with poor mental health, although that might be part of the problem. They are carrying guns because they fundamentally don't feel safe. They don't feel safe on their way to and from school. They don't feel safe at school. They are experiencing a lack of safety, and it is our responsibility as adults to really to address that, right? In a not just here and there, but like in a real systemic way. And shortly thereafter, honestly, I just started collaborating with and learning from people who were doing research in this space and reading their work and taking that up and seeing the impact of these various like place-based solutions that do have such impact on communities in such positive, meaningful ways. And I honestly just found that I still do. I find it so inspiring that like when we really treat something as a public health issue, there's so much benefit that comes from that. As our research field, the gun violence research field has evolved over the past several years, this notion of gun violence as a public health crisis has been taken up in lots of ways. The former Surgeon General even declaring it as a public health crisis in 2024 was so meaningful. He and his team published this really thoughtful advisory that just did such a nice job of touching on all aspects of this issue and some very reasonable steps forward.
We look forward to linking some of your articles to this episode. So, if you could tattoo one research finding onto the foreheads of every school superintendent in America, what would that be? And here's a fun fact. According to the Pew Research Center, 1/3 of American adults, or about 82 million people, have at least one tattoo. So one on the forehead won't do any harm.
That's a really good question. What would I say? Honestly, I would say center the kids. So when we develop policy that actually centers children and their actual needs, right? They need to be fed, they need to sleep well, they need to feel safe with their parents, with their teachers. When we develop policies that actually center them, those policies usually are the ones that make the most sense, have the longest, best return on investment, are the ones that are often most effective. And so that's what I would say.
Okay, fair enough. In March 2026, you and your co-authors wrote in the Journal of American Medical Association Health Forum, a JAMA article. You and your co-authors propose shooting-free days as a new way to measure progress. Please operationalize that and tell listeners why counting these days without shootings tell a different story other than counting deaths.
Yeah, this is work that was led by Charlie Brandis, who's the chair of the epidemiology department here at Mailman. And then we had a really wonderful team of folks who contributed, and I'm the senior author on this study. It's a really interesting, if I do say, idea, and one that feels so doable, but like almost a little obvious, right? Like, why aren't we doing this to begin with? But I think the idea here is to say, how would we, instead of highlighting stretches of violence, right? Instead of highlighting, not to say we shouldn't also make sense of that, but there's a world in which we could make the case to say, let's use shooting-free days and like related metrics to be more inclusive of the prevention gains that we are seeing, right? And we're actually in a moment right now in this country where we are seeing meaningful declines in firearm homicide, for example. And so what we did in this particular study is we came up with 4 different metrics and we calculated those metrics across a sample of major US cities and then really demonstrated the feasibility of this idea. And so the idea, if we're just to the value of doing this is to really and truly help reframe this conversation to be less about the absence of safety and more about the presence of safety, and can give hopefully elected officials and others at the municipal and state levels guidance on where and when interventions are effective. This can be motivating for communities, and it can even help guide policies towards how might we sustain longer periods of peace without firearm violence in these cities. And so we really use this as an opportunity to talk through this as a concept, as an idea, and to really say that the conversation right now can and maybe should be about how do we sustain periods of nonviolence. It's an opportunity, I think, to flip the conversation about gun violence on its head, which tends to be very focused on loss, understandably, and those devastating impacts. But we think this could be a really nice and innovative way to think about progress that's being made, which feels really important in this moment.
So So, you and your colleagues are reframing how we even measure success, which is a huge conceptual shift. And you're doing this all while leading across multiple organizations. You lead a CDC funded center, founded a national research society, and now direct research at every town, all while staying on faculty. How did your EDD prepare you to lead across multiple roles between academic rigor and real world advocacy?
I feel like I've had lots of really good role models, right? So people like other faculty and scholars and many mentors who have demonstrated how does one lead with care and compassion while maintaining scientific rigor. And I just think that is when you see that in action in other spaces, it's something to model after. I have learned from the best in that way. I haven't actually described my dissertation in a long time, but it was really nice to actually do that because that is reminding me so much of how much my collaborations with Girls on the Run were a direct connection. That was a real example of research practice partnerships, that real connection between collecting data and using data to inform program implementation and program development. And so I actually think my EDD training in that dissertation itself, which I would not have done probably if I had been pursuing a different kind of doctorate. So that was a real benefit, right, of pursuing the EDD specifically. But that my dissertation really afforded the opportunity to kind of test that out without even realizing it, right? I had to manage this huge data collection effort and cultivate relationships with every single school that I was working with and maintain connections and be in close conversation and collaboration with the Girls on the Run team themselves. That training really was very formative for me in that way. But I'm also learning as I go. I also make lots of mistakes. I'm human. So, that's the other part of it, right? Is we make mistakes and we learn and we say, oh, we'll do this thing better next time. Or so that's part of it too.
Yeah, iteration, that's a part of life.
Yes, exactly.
So let's get a little personal, right?
Okay.
How do you protect your own well being without numbing yourself to the urgency of preventing firearm related harms?
That's a really good question. I think studying gun violence in schools and its impact on children is a really heartbreaking area of work. It's really hard to do that and separate how I feel about that work and then also show up as a mom and sending a fifth grader, my kid, to school every day. So I feel like that is hard to do. I'll say I do, there's a few things. One is that I really try, and I think for me, I think everybody's very different. Everybody's experience is different, but for me, motherhood has in a lot of ways forced me to when I am home to really be present to like when I am home, Nikki is we're talking about Minecraft and we're doing homework or whatever. He and I are we're together, we're hanging out, and I can't be thinking about work or focus on something else when I'm with him. And so I really try to be as present as I can for him. And I think that actually is really, really good for me because it forces me to put my work aside and to come home and be with him and be with our family in a way where I can really focus on that part of my life, which is so important. But also just in full disclosure, as you mentioned earlier, I run most days of the week, and that physical movement for me is just so, so core to my well-being. And so I'm pretty, it's very rare that I don't go running. We'll just say that. So I think that's really important for me. I see a therapist. I'm very open about this. I've seen a therapist now for many, many years, and that is incredibly helpful for me to have a space to process things personally and professionally, right? So just to have there's some weeks in this world and in this space are harder than others. So it's really nice to have a space with a licensed mental health care professional to talk through that. So I think that's really important. But then the last thing I'll say is really having like community. And I feel something that has been very, very important for me is that I'm really lucky to have just like a really wonderful and supportive family. And I am lucky that I have a lot of community at work and with my colleagues with whom I do this work. So I think that is something that I have over the last few years in particular, I'm really trying to pour a lot of time and energy into helping cultivate a space for other researchers, for students, for early career scholars to have a space and place where we can do this work and they can, even though the work is difficult, that they can feel supported. So I think and care a lot about like the mentorship of folks in our field and a lot about what we do as researchers to support one another. So I think for me, having that work community has been really wonderful, and I feel lucky to have that. So those things all together, I think, help me, with in my day to day.
That's such a powerful perspective. And thank you for being vulnerable, because vulnerability, is courageous, right? And so it's very enlightening and inspiring. So as we wrap up, I want to come back to those listening who are exactly where you once were, considering an EDD and preparing to lead in difficult, politicized spaces. So to close, let's step back to the very beginning. Picture yourself walking into Teachers College on the first day. If that version of you could see where you are now, what do you think would surprise her most, and what would make her the most proudest?
Oh, that's such a lovely question to ask. I will say I feel now, and I felt this way for a few years, but I really feel very sure that this work is my purpose. Like I feel very sure in that. And I've come to that space and place after many, many, many years, but also with a lot of like care and support from other colleagues and friends and mentors who have helped support me in this journey. So I do feel like if I could tell younger Sonali, 22-year-old Sonali, that like, yeah, 20 years from now, you will be okay. And you will be very happy and content actually with the work you are doing. That would have been really, really reassuring to hear. And yeah, I don't know. In terms of what I'm most proudest, I think that's also a really lovely question. I'm like so proud of all of my former students who are and going on to do like really wonderful, meaningful things. I think mentorship in general is something that always will feel important to me, and I hope to pay forward because I've benefited so much from the generosity of so many mentors. I think something that is important to me is to cultivate a sense of community in our research field. And however that shows up, whether it's in our research society or in our conference planning or in even the conversations and partnerships we have with lots of different groups, I think that sense of like connection to me will always feel really important. So that's probably the thing I feel most proud of right now.
Beautiful. If someone listening right now, halfway through their EDD application, was wondering if it's worth it to pursue research on something as politically charged as gun violence, what would you want them to know?
That they should go for it, and that something that could be very politically charged won't always be. And the political environment changes constantly. And what's most important is not to let the politics guide your career and your passions and your motivations, but like the work itself, right? So at the end of the day, like if you care about kids, and then pursue that. If you care about the environment, if it's reproductive rights, if it's vaccine hesitant, whatever it is that really motivates you, it has to be work that gets you up in the morning. So whatever that looks like, even if it feels like it's not the right moment, you should still go for it.
I love that. Sonali, thank you for sharing not just your expertise, but the story and humanity behind it. It's been a powerful example of what an EDD can become in the world. You are a shining light. You've officially been advised about the Doctor of Education degree, everyone. If this conversation today made you think, made you laugh, made you dream bigger, hit subscribe, leave a comment or a review, and share this episode. Your support helps these stories reach more people who are interested and ready to take the leap on their leadership journey. Until next time, keep learning, keep leading, keep finding new ways to innovate and become Addicted.